we ready? Okay, Alan.
All right, this is Tyler Gallo. He is a trained paramedic, and he's going to teach you guys how to save lives today.
Yes. All right, guys, so oftentimes you only have seconds to recognize a problem and react to it. You see someone walking down the street, they clutch their chest and they fall to the ground. One of the main problems that could be affecting them is that they could be having a heart attack, an acute myocardial infarction. All right, so I'm going to hopefully motivate you guys to go and learn CPR so that you can potentially save a life. All right, so the need to know, right? You need to know how to do adequate CPR in order to perform good CPR. So, basic, real quick, you see someone laying on the ground, what are you going to do? Go over there, check their pulse. You know, wait for 10 seconds. If they don't have a pulse, you immediately go into compression. So you just interlock your fingers, go into the middle of their chest, start compressing their chest 2 inches, do it at a rate of 100 compressions a minute. So you're doing that 30 times. Then you're going to start breathing for your patient, right? Because whether it be mouth to mouth, if you know them, you feel comfortable with that, just start breathing for them, right? And then you're giving them 2 breaths, 5 seconds apart. Breathing for them, and starting it again, okay? In an anonymous article titled "Mouth to Mouth is not needed, oxygen is," they say that 80% of cardiac arrests are witnessed, but only 6.5% of people know how to do CPR or are willing to go do CPR. That's huge. So you guys can add and increase that percentage by getting all CPR certified. Now, as far as satisfaction, to save someone's life potentially, that's huge, right? But you need to know how to do that. So there's some new scientific evidence that's come out that stated that mouth-to-mouth isn't really needed, but oxygen is. In an online article, CPR is successful without mouth-to-mouth, but not without oxygen. They did a study in rats, and that 80% of rats survived with some sort of oxygen in the resuscitation process, but only 1 rat survived when no oxygen was given. So that, oxygen will come if you call 911, paramedics will get there, and then we can start doing our work, right? As far as, the visualization, what's happening in the heart, what happens if you give CPR, what happens if you don't. If you don't, if nothing happens, they're dead. Bye, see ya, bye. If you give CPR, chances increase. Not a whole lot, but just by CPR, but we can give drugs, epinephrine, atropine, that increase that likelihood. So basically the coronary arteries in the heart, they begin to narrow, and that's because of the buildup of plaque. And that causes a decrease in blood flow. So that decrease in blood flow means cells die. And that death of the cells is what caused that heart attack, and then that patient dies. Andrew Pollack, who wrote a book, Emergency Care and the Transportation of the Sick and Injured, he's a doctor, states that pain of a heart attack is that cells dying in your heart. Once those cells die, they cannot be revived. So what you guys, hopefully, need to do, go as far as action-wise, you can go to American Heart Association for $75 to $90. You can take a CPR class. 6 hours during the day. Super, super easy. Very well worth it. Because you, like I said, have that opportunity to potentially save someone's life. So, including perspective, once again, encourage you guys potentially save somebody like a loved ones or a friend